Anil, biomarkers indicating liver disease, long-term outcome, do we have some?
Yes. So over the last 20 years, I think, as in any other organ, there has been a tremendous amount of interest in looking at biomarkers that could either diagnose or prognosticate liver disease. But the difficulty has been that liver is a very complex organ. It doesn't produce one single function. It has its synthetic function, it produces various proteins, it has a detoxification function, and they're going side by side. What is the most complicating factor is that liver has a tremendous regenerative potential. So when liver is injured, there is a constant repair. And those mechanisms to catch and how are they affecting the process that these biomarkers are going to predict has always been confusing. So till date, there is not a single biomarker in isolation that can predict what's going to happen to a patient when they are under treatment, they are not on treatment. So that has been a major stumbling block to the success of biomarkers. Unlike cardiovascular disease, where there are successful ones, liver has been behind on this.
Okay. Let's go to a specific condition, fatty liver. Is there any biomarker? Because this is quite common with the
Yes.
obesity,
Yes.
already starting up in childhood.
Yes. So I think the field of biomarker got reactivated since we started identifying fatty liver disease, mainly because it's much more common than we think. And currently the gold standard to look at liver is liver biopsy. But to do a liver biopsy in a community is not going to work. And also these diseases are dynamic. Liver biopsy gives one-time snapshot. So we need a dynamic test that will be a biomarker. So there has been a lot of biomarkers evaluated on 2 or 3 fronts, looking at inflammation, looking at fat, and looking at scarring or fibrosis. And most of the end point of these diseases is fibrosis. So there is some success with markers like hyaluronic acid or adipokines putting together more than one to act as a biomarker.
But fatty liver disease is not the destiny, is this right? If you change your lifestyle,
Yes.
if you lose weight, if you change your exercise level, what happens or what can happen?
Yes. So there has been a lot of, how to treat fatty liver disease. The only treatment that has worked so far is weight loss, weight loss, weight loss. Whatever way you do it, you eat less, you eat healthy, do exercise.
And this works even at the state of fibrosis?
So if you not have an advanced fibrosis, it's reversible. If you have very advanced fibrosis with scarring and complications of it, then it's very difficult to reverse it.
One last question. Infectious liver disease, for example, hepatitis C. Is there a biomarker which indicates when I have to treat?
Yeah. I think with the success of the medication that has come now, it's easier now. So if you have a virus, you like to get rid of the virus, whether your liver is bad or not. Few years back, when the treatments were not that good, then people were trying to select people who can take that chance and take the side effects. So I think it will change. So markers are the same, the fibrosis marker, inflammation markers, and people have come with different composite algorithms, and added on to that is a fibroscan test, which increases the sensitivity and specificity of fibrosis. So yes, there is availability, but given the efficacy of the treatment now, I don't think they will be required long term.
Okay, thank you very much.
Thank you, Ferdinand.